Thank you again. And again, I'd like to express my deepest thanks for Lily as well for this kind invitation and for giving me a chance to speak about how to reduce the hope in the management of patients with psoriasis by using tools, by using Ixekizumab. Okay, so today we want to look through the lens to find the lasting, constant mitigation and management for psoriasis. I wanted to start my talk today with this case scenario. We have this patient, he is a male patient, he is 25 years old, and he had psoriasis for the last 3 years, with highly impact of quality of life. And as you can see, he is depressed, he is socially isolated, and he is always covering his head by a hoodie to cover the underlying scalp psoriasis. And the patient also recently, he had disseminated plaque psoriasis covered all over his trunk. And recently, he started to have a joint pain, limitation of movement, swelling, affecting small joint of both hands and feet, and also affecting the big joint of knees and also both elbows. So, if you have this patient in your clinic and you are a dermatologist, so how to deal with that patient and what are the lines of treatment you can suggest for him to improve his quality of life and to control his condition with psoriasis. We will go back for the real life, for the daily practice. I have this patient, he is a male patient, he is 33 years old, and he has a severe form of psoriasis as well, with a BAS score 18, and the body surface area affected is 20%, with a highly impact of quality of life. If you are looking for the clinical picture of the patient, we will see that we have a disseminated plaque psoriasis affecting most of his body, and also he had as well genital psoriasis. So if you have this patient in your clinic and he claimed that he already tried many topical treatment, he tried as well also phototherapy, he tried even the classic immunosuppressive, but there is no any improvement. So how to deal with that patient? So we'll go back for this patient during our talk today. So psoriasis. As you know, psoriasis is considered more than a skin disease. It's considered a multi-systemic disease that will be associated with many symptoms and signs. So clinically, it will be characterized by presence of red, thick, and scaly plaques, and also will be associated with many symptoms, especially itching and skin pain. If you are looking for the pathophysiology of psoriasis, we will see that we have many and complex interplay factors, including genetic factors, environmental factors, immune system, dysregulation, and it will be associated with many comorbidities, high affection of quality of life, and increased mortality rate. And even may be associated with sexual impairment as well. Skin pain is considered an important symptom in the patient with psoriasis and will impact the quality of life of the patient. So it will lead to impairment of relationships, sleep, daily activities, walking, work, and even the enjoyment of life. And as I mentioned before, psoriasis will be associated with many comorbidities, and these comorbidities will decrease the life expectancy for the patient. And these comorbidities may include, and are not limited to, metabolic syndrome, type 2 diabetes mellitus, dyslipidemia, obesity, also may be associated with a joint disease, especially psoriatic arthritis. And as you know, we have about 30% of the patients with psoriasis may develop psoriatic arthritis as well. Also, it will be associated with depression and anxiety, suicidal thoughts, cardiovascular disease like myocardial infarction, COPD, hypertension, and may be also associated with inflammatory bowel disease, especially Crohn's disease and ulcerative colitis. If you are looking for the current line of treatments for the patient with psoriasis, and as you know, we have topical treatment, and we have phototherapy, we have classic immunosuppressive, including cyclosporin, acitretin, methotrexate, and we have the advanced therapy, we have biologic therapy. And as you can see, we have TNF-alpha inhibitors, IL-23 inhibitors, IL-17 inhibitors, and even we have the small molecules inhibitor like phosphodiesterase type 4 inhibitor, and in the pipeline we have TYK2 inhibitor as well. But although we have all of these variety of medication, we have unmet needs for the patient with psoriasis. Because we will see that the treatment satisfaction and the persistence for the patient with psoriasis is very low, as up to 75% of the patients with psoriasis, they are considering themselves as dissatisfied with the current treatment. On the other hand, the persistence on the biologic treatment is still very low. And this non-persistence may be due to many reasons, as you know, maybe due to lack of efficacy, loss of efficacy, maybe due to safety concern, or maybe due to like financial issue, like failure of the insurance covering. And despite the clear benefits of complete skin clearance, we still see that the most of the patients are undertreated. For example, you can see in the left side of the graph, the patient with body surface area more than 10%, we'll see that we still have 50% of the patient, they don't take any type of treatment. And only 5% they already taking biologic therapy. And in fact, dermatologists and the patient have a different treatment expectation and goals. For us, we are looking to get a low risk of serious infection or cancer. We want to get a manageable tolerability for the medication. We want to get the skin lesion be improved, and we want to improve the access for the therapy itself. But for the patient, of course, the patient, he wants to get a complete clearance of the skin. Also, the patient, he wants to get a low side effect as you can. And also, they want to be able to live a normal, everyday life. And actually, we will see that we have that the complete or near complete skin clearance will be associated with improvement of the well-being and quality of life of the patient. So we have improvement of the functional status, intimate and social relationship, financial cost, work productivity, and also they will enjoy their life. And as Confucius said, if it is clear that you cannot reach your goal, so you need to adjust your steps and not to change your goal. So we are looking for a molecule that will make that balance between the effectiveness and in the same time the safety profile in the management of the patient with psoriasis. And in the same time, this molecule will cover all races and all ages, including pediatrics, adult, and also will include the adolescent. And if we have this molecule, actually it will be like a gift. And this gift, not only for the patient, but it will be also for us, for the treating physician. So we wanted to choose the right treatment for today's and tomorrow. And actually, we have now Ixekizumab, we have INT'Ls. And as you know, INT'Ls is a monoclonal antibody that will selectively target interleukin-17A. We know that we have many options of management. We have many biologic treatment, and actually all biologics and all molecules, they are working well. So the issue is not to achieve the efficacy, but the most important point here is to maintain this efficacy, is to the continuity, the sustainability of the efficacy as well. And we will see here that INT'L is showing a completely clear skin sustained over 5 years of treatment. Here we are looking for the proportion of the patient achieving PASI 75, PASI 90, and PASI 100 from the week 12 to the end of year 5. And as you can see, according to UNCOVER 3, we have about 70% of the patients, they achieve and they maintain improvement and achieving PASI 100. I mean, they have complete clearance of the skin lesion. And we will see also that INT'L is showing a rapidity of action as early as second week. And as you can see here, we have about 56% improvement of the skin lesion from the baseline in the patient taking INT'Ls, And by the end of year 5, we will see that the patient had 97% complete clearance of the skin from the baseline. So what about the management of challenging area, the hard to treat area, scalp, palmoplantar, nail, and even genital? So we'll see also here that TALT is showing a complete clearance of the scalp psoriasis, and this clearance will be sustained for 5 years. As about 90% of the patients, they have complete clearance of the scalp psoriasis by the end of the year 5. Also, we have the same improvement in the nail psoriasis, as about 80% of the patients, they achieve and sustain complete clearance of the nail psoriasis up to year 5 with a complete clearance of the lesion of the nail with NAPS score equal 0. The same also in the genital psoriasis. We will see we have as well 60% of the patient achieve complete clearance of the genital psoriasis by the end of year 5. And actually, TALTs and Ixekizumab, they have a unique clinical studies in the form of head-to-head study against other current biologic treatment from different classes. So they have head-to-head against Ixekizumab as an example of IL-23 inhibitor, also against ustekinumab, IL-12 and IL-23, etanercept and adalimumab. And you will see that TALT is showing a superiority in getting a complete skin clearance comparing to the other competitor. So you can inform your patient, yes, you will get a good and excellent result by using TALTs. But of course, we are giving TALTs subcutaneous and not intracranial. Lastly, we have the real-world evidence showing the efficacy of TALTs as well. And as you can see, we have this SOHO real-world evidence data showing that 3 out of 4 patients, they achieved clear or almost clear skin lesion with TALTs by the end of week 12 when compared to other approved biologics found in the market right now. And also we'll see that TALTs showing a comparable effectiveness across all studied patient subgroups. So up to 4 out of 10 patients across the studied subgroups, they achieved BAS 100 by the end of week 12, regardless of the different demographics and the disease characteristics, regardless of the sex, the difference of sex, the difference of age, races, body mass index, disease duration, and even if there is any associated or no psoriatic arthritis, and even if the patient has a history to be treated by biologics or no. We will see also the TALT's effectiveness in the clearance of nail psoriasis also the same. So 6 out of 10 patients achieved complete clearance of the nail psoriasis, also comparing to the other approved biologics in the market. Also 7 out of 10 patients achieved clearance of the scalp psoriasis by the end of week 12, also comparing to the other biologics in the market. So we can say that TALTs achieved a clearance of the psoriasis in challenging body area and even in the whole body. So we can see here regarding the nails, scalp, genital, and palmoplantar, as well as the face and neck. What about the safety of TALTs? Actually, we will see that the most adverse events of TALTs will include upper respiratory tract infection, fungal infection. Sometimes we have also injection site reaction. But the good thing is that most of these adverse events are mild to moderate and easy to be manageable. And the good thing is they will not push the patient to stop the medication. And also, the patient can use it and he will find the great effect by time as well. And across 15 global psoriatic clinical trials and more than 6,000 patients included in the clinical trials, we will see that TALTs has also helped more than 300,000 patients globally over 6 years. And right now, we have the citrate-free formula. And as you know before, TALTs has citrate included as a citrate buffer, but now the available TALTs now without any citrate. So it is the same active ingredient, the same prescription, the same storage, the same device, the same efficacy, but with no citrate buffer and with less injection site reaction. So you can inform your patient also about this. You will not find any pain anymore. So what about the dosage of TOLS? As I mentioned before, it's indicated for pediatric and adolescent and adult. So for the adult and the adolescent, for adult, we'll see that the loading dose, it will be 160 milligram at week 0. And after that, we have 80 milligram every other week for 3 months. And the maintenance dose will be 80 milligram every 4 months, every 4 weeks. For pediatric, more than 50 kilogram and more than 6 years. Also, the loading dose, it will be the same like in adult, so it will be 160 milligram at week 0. And later on, we have maintenance dose, 80 milligram every 4 weeks. So we'll go back for our patients that we mentioned before. So this is a clinical picture of the patient before treatment. Also another picture for the lesion, and as you can see, disseminated plaque psoriasis affecting most of the body, even here in the lower abdomen due to the friction with the belt. Again. So this patient has a history to be treated by topical steroids, topical emollient, topical vitamin D derivatives, and sometimes he already taking antihistamine for the itching, but also nothing work. So my management goals for this patient, I want to give him a rapid symptomatic control, long-term disease control, sustainable result. Patient should be adamant and compliant for the medication. I want also to improve his quality of life. So I start to give the patient TOLS. And as you can see, this before injection and this after the second injection only. We can see that we have a good response after second injection. But after 12 weeks, we don't have any lesion at all. We have complete clearance of the skin lesion. And this patient before, this for legs, and after second injection, excellent response, but we want more. So after 12 weeks, we have complete clearance of the lesion. Also this before, after 2 weeks, and after 12 weeks, as you can see. So the patient had a rapid clearance of the skin lesion, improvement of quality of life as expected, and there is no any side effects were noted. So we can say that TOLS is showing a complete clearance of that will last for 5 years, and rapid and visible response as early as second week, and constant result in challenging body areas. And as you know, TOLS is indicated and now has 5 indications. It is indicated in the treatment of adult psoriasis, pediatric psoriasis, radiographic axial spondyloarthritis, and non-radiographic axial spondyloarthritis, and also, of course, psoriatic arthritis. And by the end, we have short message for our friends that we met in the beginning, that actually, as a dermatologist, we understand your feeling and we know your suffering. So we want, and our goal is to help you, to improve your quality of life, to control your psoriasis. And we are lucky now that we have many options. So we can decide and choose wisely what is the suitable medication for you. So finally, you can enjoy your life and you can be happy again. Thank you very much for listening.